My name is Amir Harb. I'm a PGY2 internal medicine resident at Advent Health Orlando, and I will be presenting a minimally invasive extraction of a non-valvular pulmonary artery papillary fibroelastoma. Introduction. Papillary fibroelastomas classically involve aortic or mitral valves. We report a case of a papillary fibroelastoma originating in the main pulmonary artery without valvular involvement, which was extracted by transcatheter snare removal assisted by a penumbra device. Case presentation. An 83-year-old woman with a past medical history of hypertrophic cardiomyopathy and ventricular ectopy presented to the hospital after an outpatient TTE revealed a mass in her main pulmonary artery. On arrival, she was hemodynamically stable. A TEE demonstrated a pedunculated mobile mass on the posterior wall of the main pulmonary artery, approximately 1 centimeter proximal to the pulmonic valve. Cardiac MRI suggested that the mass likely arose from the intimal surface. Given the patient's personal preference and comorbidities, a minimally invasive approach with transcatheter vacuum-assisted removal of the pulmonary artery mass was chosen over open heart surgery. Management. A snare was used to engage and extract the mass. After selective angiography showed no signs of distal pulmonary embolization, a penumbra device suction catheter was then used, which nearly removed all of the remaining friable stock. Pathological investigation of the retrieved specimen revealed scant avascular papillary fragments and myxoid stroma, which was consistent with the etiology of papillary fibroelastoma. She was discharged on oral anticoagulation due to concerns about endothelial injury from the resection of the mass. From the center panel, you can see on the right image showing a cardiac MRI with a pedunculated mass circled by a yellow circle. On the left panels, you can see transesophageal echocardiography showing the pedunculated mobile mass. Discussion and conclusion. Non-valvular pulmonary artery papillary fibroelastoma is an exceptionally rare benign cardiac mass. Given the patient's advanced age and comorbidities, a minimally invasive approach was preferred over open heart surgery. Minimally invasive techniques, including vacuum-assisted retrieval, can be considered a viable option for removal of pulmonary artery papillary fibroelastomas in high-risk patients. However, further studies are needed to evaluate the long-term outcomes and safety of these procedures.